I am mobilizing young people to create solutions to the challenges in their communities that will change their lives, their countries, and the entire world. We do so by providing the opportunities, platforms, and safe environments young people need to foster their creative confidence and self-efficacy. My name is David Moynihan Sengeh. I am from Sierra Leone, and I represent the organization Global Minimum and Innovate Salone. We help young people develop relevant solutions to pressing issues in their communities by providing them with the resources, expert mentorship, and an expansive network of other young innovators in Sierra Leone, Kenya, and Cape Town. I am also a PhD student at the MIT Media Lab. My research uses advances in medical imaging, 3D printing, and predictive biomechanical modeling to design comfortable prosthetic sockets. This research will directly change the lives of amputees across the whole world, from US veterans to landmine survivors in Cambodia. As an innovator, I'm driven to develop solutions that enable people to live meaningful lives. As a social entrepreneur, I dream of a future where a young girl in my country, Sierra Leone, can develop off-grid solutions to address her energy needs. Now, through our commitment at CGI to develop accessible innovation labs in Sierra Leone, in collaboration with companies like Autodesk, Segal Family Foundation, MIT, amongst others, we are already on the way. Please join us in creating a world where all young people are driven to become innovators in their communities. Thank you very much.
In 2010, I learned for the first time that malnutrition and chronic hunger cause a devastating condition called stunting in children. It was shocking to try and grasp the scale of this tragedy with more than 30% of the children in Africa affected. Stunting is irreversible. The child is physically, neurologically, and economically disadvantaged their entire life. This was an activity that I knew I had to work on to end stunting. It was bigger than a single individual. It demanded a mobilization of uncommon collaborators be brought together. My name is Howard Yana Shapiro, and I am the Chief Agricultural Officer for Mars Incorporated. Alongside Abraham Miyake, the CEO of NEPAD, the development arm of the African Union, we brought together a group of skilled and motivated individuals to design, plan, and secure the startup resources necessary. At CGI in 2011, we announced the African Orphan Crops Consortium, a commitment to improve the nutritional level of 100 traditional food crops in Africa. The Beijing Genomic Institute, Life Technology, the World Agroforestry Center, iPlant, University of California, Davis, and Mars Incorporated are funding the initiation costs of this commitment. Over the last 2 years, we have raised approximately $40 million in in-kind donations, and we are not stopping there. We will now raise $10 million more to pay for the project for the next 5 years. December 2nd, 2013 is the opening of the African Plant Breeding Academy in Nairobi, with plant breeders chosen pan-Africa attending. The future changes that day. We are working to end stunting in Africa now and forever. Thank you.
Good morning. For the past 200 years, Black faith leaders have mobilized communities to build lasting social change and to ensure equality under the law. But today there's a new fight. The lens of mobilizers in the 21st century needs to shift its focus to address the domestic AIDS epidemic. I am Shavon Arline-Bradley, Senior Director of Health Programs for the NAACP, an organization that has for more than a century fought to bring this nation together. Today, many lives are imperiled by HIV and AIDS, particularly in the Black community. African Americans are far more likely than any other demographic to be infected by HIV. It is a clear social justice issue. In a unique partnership with Gilead Sciences, our commitment called the Black Church and HIV, the Social Justice Imperative, it enlists the Black clergy in a powerful movement to end AIDS in the Black community. During the next 5 years, we will work with 3,000 Black faith leaders in 30 U.S. cities to drive a life-saving message home to millions of congregants. Get tested for HIV, and yes, if you're positive, get treated. This is a bold commitment, but only bold action will end AIDS in Black America. We're confident, and I am full of hope that the re-energized power of the pulpit will help us see an AIDS-free generation in our lifetime. Thank you.